This is MS Television Network and I'm your host Nasir Uddin. As you know that the coronavirus is rapidly spreading in Pakistan. Government has warned if the people did not follow the SOPs, the number of COVID-19 patients will reach up to 1 million till end of July. Today we will discuss the current situation of Pakistan and take a review about the safety measures being taken by the government to save the nation from this calamity. Let me see a special report in this regard. Coronavirus, a disaster for the whole world, now starting badly hit Pakistan. Next 2 months might be explosive for the country. A peak of the virus is expected around August. Pakistan has been ranked among the top 10 countries in the world. Pakistan reporting around 5,000 coronavirus cases and more than 100 deaths daily. Cases of pandemic now is stretching to 2 lakhs with 4,000 deaths in the country. 75,000 cases of coronavirus reported from Sindh, 72,000 from Punjab, 25,000 from KPK and 15,000 from Balochistan. Similarly, 2,000 deaths reported from Punjab, 1,500 from Sindh, 1,300 from KPK and 200 from Balochistan so far. Large number of renowned personalities including political, religious, social, sports and showbiz, besides federal and provincial ministers, senators and members of national and provincial assemblies also infected by coronavirus. They are now under treatment in different hospitals. Some of them are in serious condition. 1,500 personnel of Sindh police and more than 2,000 medical staff members including hundreds of doctors and 1,500 cases of pandemic also reported from Central Jail Karachi. Now the coronavirus pandemic has spread to every nook and corner of the country. Major cities including Karachi and Lahore contributing the highest number of cases. All major hospitals in the country are running out of capacity and no longer admitting patients. The expert had warned the government in April not to relax the lockdown considering the country's healthcare system. The relaxation of restriction on May 1st and lifting of the lockdown on May 22 has caused the rate of infection to increase multiple times. World Health Organization expressing great concern over the hasty lifting of restrictions alerted Pakistan to its high positivity rate and underlined the seriousness of COVID-19 situation and poor efforts of the government in this regard. As a strategy to help contain the massive transmission of coronavirus, the WHO recommended to impose 2-week lockdown. WHO also advised the government to enhance daily testing capacity to 50,000 to assess the actual prevalence of coronavirus across the country. On one hand, the country has been passing through a serious crisis, but on the other hand, a traditional war between the government and the opposition is going on over the issue of lockdown. On one hand, the country has been passing through a serious crisis, but on the other hand, the traditional war between government and opposition continuing since lockdown began. Opposition leaders criticizing that lifting of lockdown has caused the rate of infection to increase multiple times across the country. Pakistan People's Party Chairman Bilawal Bhutto Zardari said the Prime Minister and his government has sabotaged Sindh government efforts made to contain the virus and undermine the lockdown policy through a consistent campaign to misinformation only to save their businesses, leaving the country to suffer massive losses on both fronts in health and economy. The federal government continued to deny the importance of lockdown despite repeated demands of doctors. Prime Minister Imran Khan said that his government is among the pioneers of the smart lockdown approach, which allows people to resume economic activities while observing standard operating procedures. He said the entire world now understood that lockdowns are not solution to the pandemic. Lockdowns restrictions only slow down the spread of the virus. Pakistan is a poor country and we have no choice but to reopen the country. He appealed to the nation to follow the SOPs in every field of life, especially in market and business places. Only precautionary measures can help to defeat the coronavirus. Please take SOPs seriously for your loved one and elderly. Otherwise, we will come under worse situation. This should be mandatory for everyone to wear mask whenever you move outside your home. See you again in our next program. Goodbye.